Are you still limping from that nagging Achilles pain? Let's talk about how platelet-rich plasma might help and when it won't. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in nonsurgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments that are safe, effective, and personalized to you. Achilles tendonitis is a common overuse injury I see, especially in runners, weekend warriors, and even folks who just recently started getting active again. It's painful, it's frustrating, and if you've tried rest, ice, physical therapy, and nothing's worked, you might be wondering, can platelet-rich plasma, or PRP, help heal your Achilles tendon? That's what we're breaking down today. We'll talk about when PRP works, when it doesn't, and most importantly, why treating the surrounding tissues like ligaments, tendons, joints, and nerves can be the real game changer. Let's start by breaking down what Achilles tendonitis actually is. The Achilles tendon connects your calf muscles to your heel bone. It's the thickest, strongest tendon in your body. But when it gets overused or overloaded, whether from too much running, walking, or even standing on hard surfaces, it can become painful and swollen. In many people, the real issue isn't just inflammation, it's degeneration. The tendon fibers become frayed, weak, and don't heal properly. That's why just icing or resting usually isn't enough. There are two main types. There's insertional Achilles tendonitis, which is pain right where the tendon attaches to the heel. And then there's mid-substance Achilles tendonitis, which is pain a couple inches above the heel, right in the middle of the tendon. Both types can cause serious limitations, and if left untreated, can lead to partial tears or even full ruptures. Now let's talk about PRP, or platelet-rich plasma. This is a treatment we do in the office using your own blood. We take a sample, spin it in a centrifuge, and concentrate the healing platelets. Those platelets are filled with growth factors, which are natural chemicals your body uses to repair tissue. When we inject PRP into an injured area, we're giving your body a focused dose of its own healing power. It's minimally invasive, does not involve steroids or surgery, and supports your body's own ability to heal. But here's the key. PRP only works well if you're treating the right problem and the right tissues. So when is PRP a good option for Achilles pain? Here's what I look for. To begin with, you've had symptoms for 3 months or more. You've tried physical therapy, rest, and loading exercises, but still have pain. Your imaging, like an ultrasound and MRI, shows degeneration or micro tears in the tendon. Your pain is localized and not spreading to other areas. There's no full rupture or large tear that's needing surgical repair either. In these cases, PRP can be very helpful, especially for mid-substance tears, tendinosis, or where there's degeneration in the center of the tendon. We use ultrasound guidance, which is essential to precisely inject PRP into and around the damaged tissue. That's critical because you want to make sure the treatment goes exactly where it's needed. Over the next few weeks to months after treatment, patients will typically notice progressively less pain, better strength, improved ability to walk, run, and be active again. But that's not where the story ends. Here's where many clinics and providers miss the mark. The Achilles tendon does not live in isolation. It's part of a complex system of joints, ligaments, tendons, and nerves that all work together in the ankle. This complete treatment approach is called prolotherapy. And if you're only treating the tendon, you may be missing the root cause. Let me give you a few examples. Sometimes the real problem is instability in the ankle joint. If your joint is loose or not tracking properly, the Achilles has to overwork to make up for that. Other times, the weakness in the supporting ligaments, like the deltoid ligament or the subtalar joint ligament, may be driving some of your pain and instability into the Achilles tendon as well. There may also be nerve sensitivity, especially the sural nerve or the tibial nerve can also contribute to lingering pain in that area. Sometimes pain in the ankle actually originates from a pinched nerve in the lower back. So when I treat Achilles tendonitis with PRP, I also evaluate and sometimes also treat the ankle and subtalar joints, the tendons, the other tendons around the ankle, the other nerves around the ankle as well. That could be the peroneal, the tibial, and the sural nerves, the ligaments on the inside and outside of the ankle, and even sometimes the plantar fascia if there's heel pain or two. And also sometimes the lower back if there's evidence of a pinched nerve there as well. This approach is what makes the difference between short-term relief and real long-term recovery. Now let's talk about when PRP is not the right choice. If you have a complete tear or full rupture of the Achilles tendon where the tendon has been split apart and pulled away, then PRP is not going to fix that. Surgery is needed in those cases. If your pain is actually coming from a pinched nerve in your back or from chronic neurologic issues, PRP to the tendon alone will not be helpful. Or if you've not already tried basic conservative care like eccentric loading exercises, supportive shoes, or physical therapy, then you really should start there first. And if you're looking for a quick fix or haven't made lifestyle changes to support healing, like reducing load or improving movement, then the benefits of PRP may not be as thorough and may be limited compared to if you've made those kind of changes. Remember, PRP is not a magic bullet. It's a powerful tool, but only when used at the right time, in the right context, and as part of a full treatment plan. Let me share a quick case. A patient came to me with chronic Achilles pain, over a year of burning and tightness symptoms, worse after standing all day. She'd had previous cortisone injections that did not help. Physical therapy did not help enough either. An MRI showed mild tendinosis, but I also found instability or laxity in her ankle joint and sensitivity over the sural nerve as well. We did PRP to the Achilles tendon, plus prolotherapy to the ankle ligaments, and perineural injection therapy for the nerve itself. Within 3 months, she's walking pain-free and back to hiking. That's the power of treating the whole system, not just a tendon in isolation. To wrap this up, here are the key points. PRP can be a great option for chronic Achilles tendonitis, especially if conservative care has not worked. It's most effective when used in the right patient with proper guidance and evaluation. The real results happen when we treat the whole system, not just the tendon alone. That means addressing joints, ligaments, nerves, and even biomechanics. And lastly, PRP is safe, effective, and a smart choice when surgery is not needed. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're struggling with Achilles tendon pain or other chronic tendon issues, we're here to help with a personalized treatment plan. You can schedule a consultation directly through our website as well. Thank you for watching. Live well, move smart, and take care.